CORALLEEN trial was also a trial running by Solti. It was running and published the data in this meeting in 2019. It was a neoadjuvant trial in hormone receptor positive HER2 negative tumors, all luminal B by Prosigna, and these patients were randomized to receive standard neoadjuvant chemotherapy with anthrocycline and taxane versus letrozole and ribociclib. After 6 months of treatment, the patients went to the surgery, and the primary endpoint were the rate of risk of recurrent low after 6 months of treatment. The primary result was also published in Lancet Oncology that year, and the thing that we observed is the rate of the risk of recurrence low was the same in chemotherapy and in the ribociclib arm, but also the overall response rate, the PCRs, the PP score, the rate are really similar. That means that perhaps we can spare the chemotherapy in some patients and with a combination of letrozole or ribociclib or other endocrine therapy. So now we presented a translational study from the samples of the CORALLEEN trial. We have done a huge translational plan with Ki67 immunohistochemistry, RNAseq for the samples, sTILs, immune signatures, and other biomarkers. And at the end of the day, the thing that we see is that there is a clear decrease in the proliferation of the tumor after CDK4/6 inhibitor more than in chemotherapy arm. And on the other side, we see a more low decrease in tumor cellularity after chemotherapy. That means that, as we know, there is a clear mechanism of senescence with the CDK4/6 inhibitor, ribociclib in this case. But the more interesting thing is the immune system are opposite in both treatment. That means the increase in the immune system and the immune infiltration are higher in the tumor with a very high response with the chemotherapy. And on the other side, the increase in the immune system and in the immune signature are increased in the tumor with bad response to ribociclib. And this is a very interesting fact because we can think in new strategies of combination of immunotherapy in patients with a very bad response or bad response to the CDK4/6 inhibitor, even in the adjuvant setting, or metastatic setting. In this line, we are now running the RIBOLARIS trial, an adjuvant trial with ribociclib and letrozole, run by Solti in collaboration with Novartis and Unicancer. In this case, it's a trial with 1,500 patients that receive letrozole and ribociclib for 6 months, as in the CORALLEEN trial, but we have also an adjuvant part with ribociclib and letrozole after the surgery in the very good response patients, and the patients with not so good response, we have chemotherapy, adjuvant chemotherapy. And for sure, we can validate all these biomarkers and all our findings in this new trial.